Students, now in our continuing discussion on diabetes mellitus, how do we establish a diagnosis of diabetes mellitus? How do we say this patient's a diabetic, this one is not? Well, let's look at the criteria involved. Okay, diabetes mellitus diagnosis. Now, before we come to a diagnosis, let's look at some risk factors here. Risk factors. Risk factors for developing diabetes and cardiovascular disease. It's going to be pre-diabetes. That's the key. Pre-diabetes. A whole thing to think about. All right, pre-diabetes. Before venturing right here, what are the normal fasting blood sugar levels? Fasting blood sugar, 70 to 100. 70 to 100 milligrams per deciliter is considered normal. Okay? And when we say fasting blood sugar, remember 8 hours. The patient has nothing to eat for 8 hours, then we check their blood sugar. Okay? Back to pre-diabetes. Pre-diabetes. They're not a diabetic yet. And we hope they won't be. Alright, in our pre-diabetes concern, we have impaired fasting glucose, which would be a number 100 to less than 126. 100 to less than 126. They are not normal, but they're not a diabetic either. Or impaired glucose tolerance. Impaired glucose tolerance. And that's based on a test, which we'll discuss a little bit later, the oral glucose tolerance test. Okay, on that test, they first do a fasting blood sugar, and the fasting blood sugar, again, 100 to 125, and then they load them with carbohydrates and check their blood sugar out 2 hours later, and it'll be in a range from 140 to 200. 140 to 200. They should be below 140. But 140 to 200, 2 hours postprandial, not a diabetic yet, but not normal. Okay. It's very important to identify a patient at this stage because we can do something about it. At this point, when we identify them, we can encourage them, if it's a weight issue, start losing the weight, and also physical activity, exercise. Exercise, losing weight. We can put a great delay in the diagnosis of diabetes mellitus. This is hope. Now, let's go over to diagnosing diabetes mellitus. Over here. Okay. First, you see the number 2. You see the number 2 here. That's because any of these tests that we're going to talk about has to be done on 2 separate occasions. It can't be a one-shot deal and you diagnose a person with diabetes. Okay? All right. So, with that in mind, the first criteria are, the first criteria is this. They have symptoms of diabetes, polyuria, polydipsia, polyphagia. Remember our 3 Ps. They're always hungry, they always want to drink, and they always have to void. They always have to urinate. The 3 Ps. Okay. The 3 Ps with a random glucose level of equal to or greater than 200 milligrams per deciliter. Okay. That tests positive. Alright, that's a test positive, but it has to be on 2 separate occasions. By the way, when we mean random glucose level, we mean that you just take the blood sugar at any time of the day, irrespective of when they ate. It doesn't matter when they ate, okay? And it's over 200. Okay. Now we get into the fasting glucose. Remember that 8 hours? They have to fast for 8 hours? If you have a fasting glucose equal to or greater than 126, 126, that test is abnormal. That test for diabetes. But again, it has to be on 2 separate occasions. Now we get to the oral glucose tolerance test. The oral glucose tolerance test. Just a little background about this. Basically, the patient will either have a normal diet, so doctor can say just have your normal diet, and then give instructions the night before the test. Or what they do is they'll encourage them to have 150 grams to 300 grams for 3 consecutive nights of carbohydrates. Okay. Then the night before the test, their NPO, they come into the clinic and they do a fasting blood sugar. Then they load them up with a sugar drink, of 75 grams, and it's very, very sweet. And sometimes I recommend that they drink it chilled. It's a little more palatable, not such a bother. Okay? There you go with that. Then what they do is, after they get that sugar drink, they check the blood sugar 1/2 hour afterwards, then 1 hour. After the 1/2 hour and 1 hour, then they do it every hour, up to 3 hours. The key thing is going to be the 2-hour postprandial. Postprandial meaning 2 hours after eating. That's going to be the key indicator. So, with that in mind, if the 2-hour postprandial is equal to or greater than 200 milligrams per deciliter, that's positive for diabetes mellitus. But again, on what? 2 separate occasions. By the way, this criteria is established by the expert committee on the diagnosis and classification of diabetes mellitus. 1997 established, 2003 was updated. Okay? Now, supposing we find out that they have the diagnosis of diabetes, what then? What then? Okay. Medical treatment of diabetes mellitus. There's a few goals here. One, keep the blood glucose as close to normal as possible. What that we mean is that their blood sugar levels would be as if they were not a diabetic. That's the key. And also serum lipids and body weight. That's going to be very critical. How are we going to establish this? Well, the medical regimen for a diabetic is going to be on 3 arenas. 3-pronged attack, if you will. One is on nutrition, exercise, medication. Nutrition, exercise, medication. Real quick, they use the fancy term on nutrition, medical nutrition therapy. Medical nutrition therapy. Exercise, very positive for the diabetic. A few cautions, but very positive. And then medications. Medications. Insulin, when that comes in the need, insulin. Or PO by mouth, where we have oral hypoglycemics. You can also call them anti-hyperglycemics or anti-diabetic medications. All right, so the treatment's going to be here: nutrition, exercise, and medication. Let me just say this about the medication. This is a whole lifetime of study. This is the beginning, but we're coming up with new developments in the treatment of diabetes. Is very exciting. It keeps us on our toes, always studying. Again, what we establish here, though, is how do you establish the diagnosis of diabetes? 2 separate occasions. Fasting blood sugar above what number? Or equal to 126. Oral glucose tolerance test, 2 hours postprandial, equal to or above what number? 200. Amen. There you got it.